to A World Without Antibiotics, a Netflix original. In this documentary, we will be revisiting the past, a world where antibiotics served a purpose in treating infections. Over the past 10 years, all bacteria have become antibiotic resistant. Developing even the most common infections, such as strep throat, has a possibility of leading to a death sentence. Let's further investigate the antibiotics as they once were and how we've developed into a pandemic.
Antibiotics are chemical substances that inhibit the growth of disease-causing microorganisms, or in other terms, organisms that are not visible by the naked eye. For example, bacteria.
Helen, how exactly do antibiotics inhibit the growth of organisms?
Antibiotics can work in two ways. They can be bacteriostatic or bactericidal. If an antibiotic is bacteriostatic, it stops bacteria from growing, keeping it at a static state, whereas antibiotics that are bactericidal work by killing the bacteria. Penicillin, for example, is a bactericidal antibiotic. It works by keeping bacteria from building a cell wall, which in turn provides an opening for the antibiotic to kill the bacteria from the inside out.
Now let's take a look at what antibiotic resistance looks like in the eyes of a microbiologist.
Here we have a petri dish that is covered with a bacterium. We then placed pieces of paper that were soaked in different antibiotics on the surface of the bacteria. The places where there is a ring around the piece of paper show that the antibiotic is doing its job, not allowing the growth of the bacteria. Places where there is no ring, where the bacteria grows right up to the edge of the piece of paper, shows that the bacteria is resistant to the antibiotic. The growth of the bacteria is still progressing even in the presence of the antibiotic.
So, when I get an infection of some sort and go to my doctor, why am I not given some sort of antibiotic to treat the infection?
Antibiotics aren't useful in treating infections today because the microorganisms have developed the ability to withstand the effects of an antibiotic, allowing its growth to progress.
Antibiotics date back to 1928 when Andrew Fleming accidentally discovered and identified penicillin, an antibiotic that prevents bacteria from multiplying by preventing the formation of their cells. Antibiotic resistance dates back to 1943 when a bacterium called Staphylococcus aureus was discovered to be resistant against the effects of penicillin. S. aureus is typically found in the nose, respiratory tract, around the skin. It can cause a range of infections, anything from pimples to pneumonia or even meningitis.
How does something such as antibiotic resistance spread from just one case to a pandemic?
The bacteria that better adapt to their environment survive and reproduce. The bacteria that selects for the resistant gene does so because of a random mutation that occurs during the bacteria's replication process. For instance, if you have a parent generation that has only a few bacteria that select for the resistance gene, those few will thrive and produce more viable offspring than those bacteria who do not select for the resistant gene. As you can see in the population before selection, there's a variety in levels of resistance. After natural selection occurs, you get the after population, where only the higher level resistant bacteria survive to reproduce for the coming generations, as seen in the final population.
In the past, scientists could use genetic information from bacteria to identify antibiotics. This was done by using a marker or a short piece of DNA from the bacteria. The use of this marker allowed the scientists to identify the whole genome of the bacteria.
Interesting. So what exactly is a genome?
A genome is all of the genes present in an organism. Based on the genome, scientists could then identify what types of antibiotics would combat the bacteria.
Why was this technique useful?
This approach could be done quickly since scientists could identify the genomes of a large number of microorganisms in a short amount of time, providing an effective route for developing antibiotic treatment.
What else can scientists do when they work with antibiotics?
They could study the antibiotics that they already have and develop new uses for them.
As time went on, almost every type of bacteria had become less responsive to an antibiotic that was designed to fight the bacteria off. As of the year 2016, antibiotic-resistant bacteria were killing around 700,000 people each year. It was projected that by the year 2050, nearly 10 million people in total would be deceased due to the lack of infectious treatments available. Now we have reached an age where all bacteria are resistant to the effects of antibiotics. Over the past 10 years, the cost of healthcare has skyrocketed due to the need of a longer hospital stay and extensive drug research necessary for treating infections. Treatment options for bacterial infections have become more and more ineffective. Resistance makes treating infections in a timely manner extremely challenging.
What are the current treatment options for infections, since we don't have the luxury of getting our physicians to prescribe us with antibiotics?
The use of natural remedies such as coconut oil, oil leaf extract, or honey have become the most common substitute for antibiotics. Ingesting just a small amount of these products will all work in terms of fighting off the presence of unwanted bacteria.
As we've now approached a decade where antibiotics are of no use to us, there were certainly actions that could have been taken to prevent such resistance. These actions could have included physicians avoiding prescribing unnecessary prescriptions, or when in true need of a prescription, prescribing antibiotics that were as specific as possible for the infection at hand, instead of prescribing a broad-spectrum antibiotic such as penicillin. It's also important for patients to finish the full dosage of the antibiotic prescribed, regardless of when the infection seems to have disappeared. It should also be noted that patients should not use any leftover antibiotics from previous prescriptions or any antibiotics that were prescribed for someone other than themselves.
The phenomenon of antibiotic resistance was a crisis for many years. You may ask where antibiotic resistance is today. The world as we know it in 2050 cannot withstand an outbreak of a superbug, as it would be detrimental to the human population. For even the greatest scientists, finding a solution to antibiotic resistance has been extremely challenging and nearly impossible. Older in my face in it.
The pages are a little bent. I can't really read it.
Yeah.
That's what I'm saying. Okay.
Antibiotic. It works by.
Start over from penicillin.
I don't know why this sentence is so hard for me.
Wait, I thought she's looking at Melissa who's sitting down. She's looking at the
Just move your arm down. Put your arm like.
Are of no use.
How exactly do antibiotics inhibit a growth?
To finger have disappeared.
In two ways. They can.
Wait, pause.
I can't.
Can you move your foot?
Natural remedies such as coconut oil, leaf. The use of natural
Antibiotics that were.
Is it started?
Yes.
Oh. And how? How
Wait,
exactly?
Hold it up. Hold it up.
What else could scientists do when you can't? You're so far away. All bacteria have been
Wait.
like strep throat, for example, could have the possibility of leading to a death sentence.